Okay, for anesthesia coding, the anesthesia section is located in your CPT book right after the E&M section. Now, anesthesia coding is very, very specialized, so we're just going to do a very high-level, brief overview of this section. We're not going to go into great detail just because it is so specialized, and normally you are not going to be using this section unless you are coding specifically for an anesthesiologist, where, of course, if that was the case, then you would be going into a lot more depth training in the coding for anesthesiology. So here's, as stated in your book, just the organization of the codes, the different providers that are included. Anesthesia, of course, is the administration of a drug or anesthetic agent by an anesthesiologist or a CRNA, a certified registered nurse and anesthetist, or surgical purposes, and it's used for medical or surgical purposes to relieve pain and or induce partial or total loss of sensation and or consciousness during a procedure. The responsibilities of these providers, of course, is for airway and fluid management, preoperative and postoperative evaluations, and cardiorespiratory status monitoring. And there are a variety of levels of anesthesia that exist, ranging from local through general. And here's just, they go into more detail in your textbook, which I'm sure you all read about. So I'll kind of just skip over this one, won't go into great detail. You will also see in the postoperative period, when you're reading charts and medical documentation, where they may perform postoperative pain management for pain control. And this includes the administration of either an epidural or subarachnoid medications on the date of service after the date of surgery. There will always be continuous drug administration and usually a daily hospital management. You'll see some patients that will come in as an outpatient surgery, but then they get admitted to an observation status for pain management control. So what's included in anesthesia are pre-op and post-op visits, of course your anesthesia during the procedure, which you would want, administration of fluids and or blood, and usual monitoring. That's going to be your blood pressure, your oximetry, your temperature, and unusual forms include these unusual procedures, which can be separately coded, would be a CVP, a central venous pressure, an arterial line insertion, a Swan's-Ganz catheter, which you'll see a Swan's-Ganz used a lot in a right heart cath. The physical status modifiers, these are added to each reported anesthesia code, and it indicates the patient's condition at the time anesthesia was administered and identifies the complexity of services provided by that anesthesiologist or CRNA. It's documented in the anesthesia record. Usually in the anesthesia documentation, you will see somewhere where it'll say ASA physical status, and they usually circle the number, like the 1, 2, 3, 4, or 5 on the anesthesia form. So you don't really have to look through the documentation to try and find, okay, is the patient normal and healthy? Do they have a severe systemic disease? You'll normally, this is the main one that I have always seen. They look like 1, 2, 3, 4, 5. And this E is in an emergency status. Sometimes they might have 3E or 4E. And what that means, of course, is say a patient came in for an appendectomy and they took him straight off to surgery, or a patient came in with a heart attack and they took him straight off to surgery for a CABG. That would be when they would circle an E for an emergency. So I am going to stop right here because I'm just about out of time on this screen, and we'll finish it up on the next screen. So you will listen to part 2.